Hello everybody and welcome to today's ANROSE webinar titled Using Measurement for Making Meaning in Action Research. My name's Tina Campbell and I'm today's facilitator, and in a moment I'll introduce you to the presenters for today, but before I do that there's a couple of housekeeping tasks to run through. I just want to run through the control panel in front of you. You can see that you can hear us, but we can't hear you. And if you would like to ask a question of the presenters, just put your cursor into the field at the bottom of the control panel there, type in the question, and we've got Steph in the background who will actually manage those questions and pass them on to the presenters. You can also make it known that you'd like to speak to a presenter by selecting the hands up button. So if you put your hand up, we'll know that you'd like to ask a question and we can actually unmute you at that point in time so that you can ask a question of each of the presenters. Well, I'd like to now introduce you to our presenters. Dr. Peter Cox is a Senior Research Officer at ANROSE. Peter is both qualitative and quantitative, has both qualitative and quantitative research experience and has responsibility for ANROSE grants, including Research Priorities 2014 to 16, Research Priorities 2017 to 19, and the Perpetrator Intervention Stream. She was the Principal Chief Investigator on 2 ANROSE projects, including the additional analysis of the ABS Personal Safety Survey and a review of the literature on the co-occurrence of domestic violence and sexual assault. Violeta Pilotov is joining her. She's a Senior Research Officer at ANROSE and works specifically on the National Community Attitudes Towards Violence Against Women Survey, or the NCAS. She has also worked on the 2013 NCAS when it was led by Vic Health, and Violeta has worked extensively in the university sector on a range of projects related to journalism and violence against women, and has a master's from the University of Melbourne. So Peter and Violeta are joined by Karina Backhouse. Karina is Research Programs Project Officer at ANROSE, and she is also part of the Action Research Support Team. And also joining today is Liz Orr and Stephanie Howard. They'll kind of be in the background there, helping out and answering questions and contributing where they can. They're from the ANROSE Action Research Team, as you know. I'm sure most of you know both Liz and Steph. All right, well, thank you. I'd like to now pass over to Karina. Thanks, Karina.
Thanks, Tina. So I'd just like to start this webinar by acknowledging the traditional owners of the land across Australia from which we are meeting today. And on behalf of ANROSE, pay our respect to elders past and present. Peter Sheffing and I are joining you from the Eora Nation, land of the Gadigal people here in Sydney. And Violeta and Liz are joining from the Kulin Nation in Melbourne, land of the Wurundjeri people. So I'd also like to acknowledge Aboriginal and Torres Strait Islander people present at this meeting and pay respect to your elders past and present. And as we acknowledge the traditional custodians of the land on which we are meeting, we'd encourage you all to be mindful throughout our discussions of what the acknowledgement of country means, what it means for us in our work related to violence against women and their children, and what this means for how we include consideration of the traditional custodians that we have just acknowledged in all of our work. So welcome all. So we have joining us today practitioners and researchers engaging in action research through their Building Safe Communities for Women projects, as well as several grant managers from the Department of Social Services. As always, we do acknowledge that the work that we are doing and the discussions we have around preventing and responding to domestic violence can be difficult and personally affecting. And we'd just like to remind you that the 1-800 RESPECT phone line and resources for practitioners on their website is available to you. So today we are going to be talking about measurement and some of the ways in which you can engage with and make sense of the diverse sources of data you've been using in your action research. So this isn't going to be a Methods 101 course, which would be well beyond the scope of a couple of hours, but a short focused discussion in response to requests we've received from the Building Safe Community for Women project and in our work supporting your action research over the past 12 to 18 months. So I will provide a brief overview of ANROSE, the Action Research Research Support Project and the Building Safe Communities for Women projects across the country. And I'll speak briefly to some of the qualitative research methods being used in the project work. Peter will then speak more broadly about both qualitative and quantitative methods, talking about these methods as existing along a continuum and the use of measurement. And Violetta will then provide a bit more detail about quantitative research methods using the National Community Attitude Survey, or the NCAS, as an example. And we'll then open up the webinar for an open discussion and questions that you might have. Just moving on to the next slide. So I'll move quite quickly here, as most of you will be quite familiar with ANROSE at this point. And you can find out more information on our website or by signing up to our fortnightly notepad. So ANROSE is an independent not-for-profit company established as an initiative under the National Plan to Reduce Violence Against Women and their Children, which is jointly funded by the Commonwealth and all state and territory governments. So there are three core functions in ANROSE operational model, which will just be on the next slide. Tina, if you wouldn't mind. So thank you. So the three core functions in ANROSE operating model are knowledge production, which happens in our research programs, knowledge translation and exchange through our broad range of publications and capacity building activities, and our leadership role, which is around increasing and improving knowledge about domestic violence and sexual assault, and also about the strategies, policies, programs and services which are effective in reducing violence against women and their children. So just over to the next slide now. You can find out much more comprehensive information about our research program on our website, but just to say briefly here that Peter leads our large research priorities grants rounds, supporting high-level complex projects funded by ANROSE across Australia, and Violetta works with the team responsible for the NCAS, one of the most significant and rigorous instruments used to build the evidence in Australia around preventing violence against women and their children. So you will all be quite familiar with the Action Research Support Project, but just to acknowledge a few things about the project, which are just on, yes, there we are. So we use a broad range of discussion and collaboration methods to support participation in action research from projects. And we've also recently facilitated the establishment of a community of practice to further support engagement and knowledge sharing amongst the projects. And just as the Building Safe Community for Women projects are engaging in cycles of action research, we are too. And these are informed by a few things. These include action research, community development and capacity building principles, the knowledge and perspectives of survivors and perpetrators as represented through scholarly research and practitioner advocacy, domestic and family violence practitioner expertise, and literature specific to the focuses of each of the different Building Safe Community for Women projects. And we do work throughout the Action Research Support Project to engage meaningfully with diverse communities and more marginalised groups. So I'm just going to invite Liz to jump in here and just give a bit more context about why it is that we're doing a webinar around this topic today. So over to you, Liz.
Thanks, Karina. Hello, everyone. Look, the main thing to say is that the Building Safe Community projects have often given us feedback that they would like more discussion about measurement because action research focuses on change and creating change. So they requested that we have this discussion about measurement. In saying that, we did invite people to send any specific questions to us before the webinar, and unfortunately no one did, but don't feel that your chances have finished. we intend to keep a dialogue with you, and if you do have any specific questions, please be in contact with us. So what we've done though is pull out between all of the ARS staff, pull out the questions that have come to our attention through our interaction with the projects about the type of things you're concerned about in measuring. And that may be around using qualitative methodologies and methods, or quantitative. So many of the projects are using survey work and also looking at involving stakeholders. So looking towards measuring participation and so forth. The main messages that we want to say in discussing action research methodology and measurement is to plan what you're going to do have a go, but don't overreach what you think you might be able to achieve with smaller surveys and so forth. So we'll come back to that as throughout this webinar as we look at the indicators that people look to measure in the violence against women field. So I'll hand it back to you now, Karina, too.
Thanks, Liz. So just before I hand over to Peter, we do just want to acknowledge that the Building Safe Community for Women projects are using quite a broad range of research methodologies. And so these include, Tina, I might just ask you if you could move forward. And just on to the next slide, please. So the projects are using, as I said, a broad range of research methodologies in their work and are doing a lot of measurement through qualitative research methods. As Liz just mentioned, one of the examples of that is particularly common is measuring around participation. So attendance in meetings, questions asked, how many volunteers, that sort of thing. And so that's been a really meaningful and valid part of the research processes for the Building Safe for Women projects. So I will now pass over to Peter.
Okay, thank you. Thank you for that introduction. I guess what I was going to initially talk about is some of the differences between qualitative and quantitative research. I think we're used to thinking of them as very distinct ideas, and I think that in some ways it's better to think about them as a continuum. I'll talk about that in a little bit. My background prior to being here was that I worked in the ambulance service in research there, and I think sometimes the examples that you get when you talk about medical research are a bit more straightforward. So I'm going to draw a bit on that while we're talking. But what I learned there and what was really key in our work was that we would go to quantitative research. We would go to research that was about counting things, about measuring things. In that case, it's very, I guess, numbers heavy. You know, you're dealing with people's temperature, whether they're alive or they're dead. You're dealing with whether they're, their heart rates are, those kind of things. Very kind of measurement-based, very numbers-based. We go to that kind of research if we wanted to know what was happening. So what was happening in a particular service, what were the outcomes. And we go to qualitative research. We go to asking people questions to understand why it was that thing was happening in the place. So the example that I was giving to Violetta earlier today was around if you were looking at falls within a hospital, you might be able to count the number of falls. That's in that kind of quantitative field. But then if you wanted to understand why they were happening, you might need to actually go and talk to people and understand what it was about the staffing or the environment or the safety rails to actually understand the quality of that experience. I think that qualitative and quantitative research are very much on a continuum. So while you might have qualitative research that is, for instance, taking interviews and discussing with people what their experiences have been, you'll then likely code that in a way, and you'll systematize that information. And then you might actually count the number of people who have particular themes. So that's starting to move that a little bit further actually into the quantitative kind of sphere. When we're thinking about qual and quant within violence against women, we're actually dealing with a fairly narrow band. We're not dealing with really kind of strong qualitative research that might be involving, for instance, psychoanalytic case studies. And we're not dealing with that really hard quant research that you might be having with some of the medical randomized controlled trials and that kind of stuff. We're dealing with basically something in between, counting a few things and asking people their experiences and why those things occur to them. If we're talking about what it is that we decide to measure, I think that this kind of work is inevitably focused around prevention. That's what the Building Safer Communities for Women projects have as their kind of focus. And so it is about that outcome that the focus needs to be. But that outcome is incredibly difficult to get to. And there's a couple of reasons for that. One of which is that it's incredibly difficult to measure something that doesn't happen. So while we might be able to measure changes in the number of women who experience violence, we can't actually measure the number of people for whom violence would have happened but it hasn't now. And so that's actually quite a complex thing to be trying to deal with. The thing that we most care about, the thing that ultimately this work is focused on, is the very thing that we have to, in some ways, always get proxies to be able to understand. In general, research, I guess, has this kind of limitation, that actually understanding the outcomes are some of the most difficult things to determine. It's much more simple to understand process, and some of the examples that Karina was describing about the number of people who attend, the number of people who ask questions, they're typical process measures. It's also relatively easier to understand attitudes, particular types of experiences or knowledge, but outcomes are incredibly difficult. And so trying to understand what it is that we can reasonably measure, what is a reasonable proxy and what isn't. And I think Violetta will talk a little bit about this in relation to the MCAS, that to assume linkages is often problematic because things that we think are going to go together might not. So you might have changes in attitudes, but you might not actually have changes in behaviour. You might have changes in the number of people who are attending something, but you might still not have changes in the number of people who are actually experiencing violence. One of the things that comes up, I think, in lots of discussions about methods is the tendency for data to be contradictory. And you certainly find when you're looking across different studies or different research sites, you'll often have different findings. And I think that often happens because research happens in complex contexts. It's really difficult to actually determine whether it is your particular intervention that has changed the behaviours or the patterns of violence in a particular place, or whether it's actually something more general that is happening within a broader community, whether if you haven't seen changes, that's because the intervention hasn't worked, or whether it might also be something else that's happening within the context in which work is happening. So I think when we see anomalies in data, when we see something that doesn't make sense, when we see findings that don't make sense, then I think what tends to be useful in those instances is to look at, well, what is it that might be needing refinement in the lens that I'm using to understand this? What is it that my assumptions about how the world is might mean that I can't accommodate those two things simultaneously? What is it about the method that might mean that particular things come in one study but not in the other? So if one study focuses on people within a particular socioeconomic status, for instance, then they might have findings of one particular sort, while other people might have findings that are different to that and seem to be contradictory, but perhaps something else is happening there. Maybe it's how you've asked the question that means that certain people feel able to answer and some people do not feel able to. And potentially what is happening is different. What is it that might be real here? I think one of the things that is difficult to determine, and particularly when you're dealing with small samples, when you're dealing with small groups of people, is trying to work out the difference between something that is an outlier, so someone who doesn't fit the general pattern of what's happening here, someone who's a bit of an oddball in the context, and things that are actually legitimate trends. So trying to determine that is often a process of triangulating, seeing how it is that what you're finding might be relating to other information that you can get from other sources and other methods. But it's also about, I guess, reality testing and determining whether this seems to be something that is sustained, whether it's a pattern that can be repeated, or whether it does seem to be that one-off. One of the things, I guess, that also comes up is a consideration of what types of questions you would like to ask. And I think that this varies a lot by what kind of method you're using. So if you're asking people in surveys, that's very different to if you're asking them in interviews. So specifically open-ended questions tend to work really well in interviews, and in fact, an interview based on closed questions that are kind of a yes/no kind of answer tends not to work particularly well. But if you ask people to tell you the nature of their experience, they can actually have really rich data. But asking people to do the same kind of work by in a survey, in something where they're writing or on a computer, tends to actually result in relatively poor data, because it takes time, it takes effort. And it means that people, particularly if you're asking repeatedly open-ended questions, they get tired, and the quality of the responses often deteriorates radically over the course of the survey. Multiple choice questions are ones that we have a list of options as an answer. And I think the risk with these is that it makes it very clear to the respondent what it is that you think they're going to say. That can be frustrating for respondents, where they feel that they're forced to make a decision about something where they might actually want a different answer. And it also tends to limit thinking. So it can be quite useful if there are a very clear set of options, but it does mean that you're only going to get people aligning with what it is that you expect. Which is, I guess, another point where open-ended are really valuable. They provide a space where people are able to tell you the things that you don't anticipate, and that's of particular value, particularly if you're not necessarily sure about what it is that you're likely to find. Scales are also, I guess, a common tool. So a Likert scale would be a typical example of that. That's where you have a scale generally from 1 to 5, from strongly agree to strongly disagree. And it's a scale that, unsurprisingly, is most useful when you're trying to understand the extent to which someone believes or supports particular understanding. So it's about the level of engagement as opposed to something that might be more binary or experiential in cases. The final thing that I've been asked to chat about briefly here is about what it is that we can do with local data. And I think that the really important thing that you can do with local data is inform what is happening within the local context. That can also then contribute to understandings of other places, and that's really valuable, but it is inevitable that a environment is very complex, and so it is sometimes difficult to determine whether something would be appropriate in another place. One of the things that is really important in that context, however, is ensuring that you don't overstate what it is that you're doing. So to have a context where you're examining people's experiences within a particular community, while that might be incredibly rich data about that community, it doesn't necessarily reflect the whole of a society. And so that doesn't mean that that data isn't valuable. What it does mean is that the way it needs to be reported needs to be careful. That you need to be able to state, this is what's happening here, this is what's happening with this number of people in that community that we talk to, this is the time period that we're talking about. By actually constraining the way that you talk about the data when you're actually writing it up or talking to people, you're actually able to say a lot more, because it means that you're making it clear what the constraints are, and that means that people are confident in what you're saying, that what you're saying is absolutely true for that community. And so you're able to, by contextualizing it within that community, making that explicit, we're then actually able to confidently make those kind of conclusions. So I'm going to now pass on to Violetta for a bit of a discussion about the NCAS and quant research.
Great. Hello. I'm just getting my introductory slide going. So I'm here today to talk to you about the National Community Attitudes Towards Violence Against Women survey. I thought that this would be a good thing to talk about, firstly, as a kind of example of quantitative research, but also potentially as a source that you might find useful, and I can go into some of the ways in which it could provide that for you, as well as offering myself as someone that you could contact if you did want to think about using the NCAS in your work, or some of the questions, for example, and how best to go about doing that. So that's another avenue. So today I was just going to give a brief overview of the NCAS, as well as describe the research process that we go through, talk about some of the findings, and also a bit about some of the resources available to you. Very quickly, in terms of the overview, the NCAS is a national survey, and it collects information about people's knowledge, attitudes, and responses to violence against women, as well as their attitudes to gender equality. It's led by ANROSE. This current NCAS is led by ANROSE, and it's supported and funded by the Department of Social Services. One of the surveys under the National Plan, and we have a really quite a large sample of roughly 17,500 people. And this is partly, this large sample size allows us to have a representative sample of Australia and of the Australian community. We use a blend of mobile phone and landlines to facilitate that as well, because having an increased number of mobile phones means that we get more people from diverse backgrounds. A lot of people aren't really using landlines anymore. So that's a little bit about the NCAS. So in terms of the survey, it is a periodic survey. There have been 3 national NCASs so far. The first was in 1995, then the next was in 2009 and 2013, both led by Vic Health. There have been changes and modifications done pretty much for each round, and that's happening again this time, and I'll talk a little bit about that process in the next slide. But I should say that we, one of the ways that we work, I think, is kind of useful to just mention. Firstly, we have an implementation group, which is the group that does most of the kind of groundwork, all of the real heavy lifting in terms of the survey. And that's a collaborative process with people from a range of universities, as well as someone from Our Watch. But as well as that, we have project advisory group, expert panel, we have review processes, and we also have smaller advisory groups that are helping us with expertise around particular population groups. So I think having this robust kind of structure around us, where we can get feedback, get input, get expertise from people with a broad range of backgrounds, really helps to ensure that the survey is as robust as it can be. So in terms of the survey, it's 20 minutes in length by telephone, and this is pretty much the kind of longest, the length, it's the optimal length, really. If it were any longer, people would start to get too fatigued to really answer the questions properly. So this is kind of the max, and this is one of the big constraints that we have upon us in terms of the survey, is that the length of time that we can have people on the phone. We ask people about their attitudes to violence against women and also gender equality, their knowledge and understanding of the problem, as well as what they would do if they witness violence, which was the way that we asked it in the previous NCAS, but are looking to do things that are asking more about bystander behaviors and precursors to violence. The survey aims to gauge the community's level of knowledge and their attitudes, as well as trying to understand what are some of the factors that might be shaping those attitudes. And obviously are looking to make some comparisons over time. We look specifically at sexual assault, partner violence, stalking, and sexual harassment, men's violence against women, and also I have a focus on primary prevention. So in terms of the process by which we kind of go through to get there, and it's obviously not linear, but I've tried to make it sort of linear. It's our step by step of what we've done. Generally, you begin with the kind of redevelopment work, trying to think about what we could do to improve the next one, and that involves literature reviewing, consultation with experts, and quite a lot of work just thinking through what we're doing. So looking at the validity of the questions, seeing where things can be updated, and all of that kind of work. And a lot of that still continues happening. And then if there's information that you can put to the next one, then you kind of put it in the bank for the next one. And after you kind of got a relatively complete version of the survey, we then go to cognitive testing. And this involves one-on-one interviews with individual people that could be potentially respondents for the proper survey, and ask them questions about the questions. So we ask them the questions, we see whether they understand the questions, we want to see if they actually understand what we're trying to get at, and if how they're responding is actually to do with what we're looking for. So just making sure that they're actually valid questions. And I think this one's particularly important in terms of language, and making sure that the language that we use will be understood by the largest number of people possible, because if they're not understanding the question, it's just the information we're going to get isn't valid. We also do scale validation and pilot testing, and I think I just thought I'd pause on the pilot testing because it's really important with the pilot testing. It's a full dress rehearsal, and it's incredibly useful to do that pilot testing to make sure that everything it works the way you imagine it would, and a lot of times you pick up things that you wouldn't have. So if you just sort of do all of that other work and then just start, you might suddenly go, oh, I should have considered that beforehand. So it's a really great important thing to do. Then we go into field work. There's data cleansing, weighting, and analysis. And I think here an important thing to point out is, again, for us at least, to have that collaborative input from a range of stakeholders with expertise in lots of different areas is really useful in all of these phases. So especially with the analysis, how we approach analysis, how we approach reporting, as well as how we actually translate that information in a way that will be useful to people. So a lot of that work is done with quite a broad range of stakeholders. In terms of why we study attitudes, I think a lot of times, and Peter was kind of referring to this, there's a bit of a tendency to maybe see attitudes as being directly related to behaviors, and the link isn't quite that strong. Attitudes don't necessarily, they can but don't necessarily lead to behaviors. There's a lot of things going on, and if you think about the ecological model, it's one factor to think about, but I do believe that they can have a role in shaping perpetration, victimization, responses, how people feel when they disclose, how people respond when they disclose, whether or not a victim might feel that they start to blame themselves, for example. But one way that I think we can relatively confidently understand the attitude survey is that it does give us a kind of sense of what the community thinks is okay and not okay, and that, or what they currently think, even if it's not necessarily good. It sets up a little bit of knowledge around social norms. Even though we're not measuring social norms, it does kind of provide a bit of a barometer around social norms, and those have been found to have a stronger relationship to behaviors as well. But I think it's just to be careful when talking about attitudes, to understand that it's not necessarily, you can't see them as a proxy for behavior. I thought I would just give a little bit of an overview of the findings, particularly if anyone actually wants to use this. I thought just to give you a bit of a taste of what we found. And I've put the encouraging findings in green and the more problematic findings below in black. So most Australians recognize that violence against women includes a wide range of behaviors. So people see emotional abuse. They do see financial abuse as a form of violence against women, not just physical assault, and very, very infrequently justify violence. these are really positive findings and can be used as well to kind of talk about where the community is at. There's also a strong tendency to support gender equality in the public arena. Although when it comes to private relationships, that's not the case. So there appears to be a contradiction there, although I don't think it's so much of a contradiction as a kind of a complexity of how to understand modern gender relations and gender norms. In terms of the concerning findings, a sizable proportion of people believe there are circumstances in which violence can be excused, and we have a range of measures of that. 43% of people believe rape results from men not being able to control their need for sex. A very large proportion believe it's hard to understand why women stay in a violent relationship, and nearly 30% endorse attitudes supportive of male dominance in decision-making in relationships, which goes back to that kind of difference between gender equality in the public arena versus the private sphere. And I've sort of summarized them a bit further in this next slide that's coming at any moment. Yes. Shall be coming. So the next slide, which will eventually come, talks about, so more about the key findings, but I think the two really that I'll point out now are just about, we created some measures to try and gauge whether or not people had high, medium, or low levels of understanding of violence against women, as well as their attitudes, so whether they have high, medium, or low violence supportive attitudes, as well as their levels of gender equality, sort of their attitudes towards gender equality. And we found that their understandings of violence against women, as well as their attitudes to gender equality, had significant impacts on their attitudes to violence, and those factors had a greater impact than any of the other factors, so any primarily demographic factors that we would have that we got through the NCAS. So I think that those ones are really important in terms of advocacy. So trying to pointing out that, you know, it's about knowledge, it's about understanding, and it's also about people's attitudes to gender equality, and that those are have a kind of predictive about whether or not what people's attitudes to violence is. I've just included a few resources here. So for the 2013 NCAS, which is still very much relevant, I believe, at Vic Health, we put together, when I was there at the time, some infographics, some really good videos, and obviously the reports, but some of the stuff is quite useful in terms of talking about this stuff. If you're doing a presentation, for example, being able to have some visuals that you can use. I thought I'd just point out that they're there, and I know at the end of the presentation there's a bit more, some links and things like that that you can use to get at some of these resources. So I will finish there, and I think we're moving on to questions. And Liz is going to join me. I'm coming back.
Hello.
Yes, we have a question, but do feel free to continue to ask and use that hand-raising function or the chat function throughout this session. So, Steph, over to you.
Yeah, thanks, Karina. So, yeah, we've had one question come through, which is about using certain questions with cold community. So this is from Kumla, and we've used the sample questions of NCAS to tailor the survey to measure the change in attitude and knowledge on violence against women among CALD community. What we found is that there are so many terminologies that don't have an equivalent meaning in some cultures. Consequently, it took a bit of time to understand the questions before providing answers. And do you have any suggestions about this?
Well, is it okay if I jump in? Yeah. Well, I think there's a range of things. There's one thing that we're trying to do for this current round of the NCAS, which we're going to have through the COG testing, we've identified a number of issues very similar to that, and what we're trying to do is have a really, really comprehensive interviewer briefing document. So then if somebody's having issues answering a question or doesn't understand the question, I know that this means that the person has to either identify that the person has an issue or they have to say that they have an issue. But if they do, that they can have some definitions and some descriptions there that can help them to explain to people what things mean. I mean, I think that's one avenue that we're taking. Does that help?
And it would be good to unmute Kumla here and see if you'd like to have any further conversation.
I will unmute. I'll jump in now. Liz, I'll unmute Kumla now if she would like to.
Okay, you guys hear me now?
There you go.
Okay, so I think one of the information sessions I believe Liz attended, and I think it took a long time for people to understand what we're talking about, some of the terms, for example, you know, LGBT, for instance, or perpetrator. Some people don't understand perpetrator or victim's relationship. But I acknowledge the suggestion that we need to have a definition and brief them. But sometimes in practicality, it's not easy to do so when we gather them all together. So they don't have time to really prepare to go through the definition. It may take, you know, a few hours before they can go to the survey. So I'm thinking how we can simplify in a simple language that can speak to different cultures and communities.
Kumla, can I ask you, do you think infographics are helpful in this regard as well?
Yeah, that would be really suggesting in terms of using pictorial surveys or number one is very simplified English, plain language. I think also we need to have a piloting, you know, the questionnaires with some of the cultural groups. So give them some advice, let them give us some advice around their understanding before we actually run the survey. So that's another suggestion I have.
Yeah, that's a really good suggestion. I think involving people in that process is extremely useful and get incredible insights that way. I mean, for the NCAS, we've even had people in the COG interviews make suggestions that have ended up going in because they're so much improvement, from what there was.
Thank you.
Did you add something? Thanks, Kumla.
I was just going to add that I think that surveys can actually be a really difficult format if you're trying to find information from people who may be having some of those language barriers. Certainly in our core grant, I don't think we've got any projects which are dealing with communities where English is not the primary language, so both culturally and linguistically diverse, people with disabilities, and Aboriginal and Torres Strait Islander people who use surveys. Rather, there's much more of a focus on using focus groups or interviews so that there is the capacity to actually spend that time and talk through in detail what it is that's actually meant, ensuring that there's a common understanding. I think there's a risk of using pictorial representations of actually reinscribing particular stereotypes or expectations around what we're talking about when relating to violence. Certainly when we've used infographics to depict findings of research, they do have a bit of a tendency to be something where, you know, you depict violence by someone being CSU, that kind of thing. You depict women as, you know, stick figures with skirts. And I think that in some ways that can be limiting. So I do think that sometimes it's about actually having a radical shift in the methodology in that kind of way into having conversations and ascertain things over time.
I agree. Another challenge I found was we assume that our participants know how to answer the questions. So there's multiple choices, but not all of them familiar with the template and the answer options that they have to answer. So yeah, I don't know, that kind of westernized philosophy of running a research resonate in any other cultural understanding that that may create another layer of challenge.
Yeah. It would be good to see if anybody else wants to put their hand up to
we've had another
conversation.
I think there are a few questions from Nadine. If Nadine is happy for her microphone to be unmuted, I'll attempt that now. 2 seconds. Nadine, let's see if you can ask your questions directly.
Hello, can you hear me?
Yes, we can hear you.
Yeah, okay. So some of them might sound a little bit critical, but I guess I'm just interested in more of the details around some of these surveys. And back to, and I forgot your name, attendee 7, your beautiful long curls. Who were really the people in the last NCAS that responded to these surveys? I'm just thinking very broadly here about someone like myself having 2 kids running around mad all day and getting a phone call being asked for a 20-minute survey. I would immediately reject to do that. So who were the people who were surveyed?
Well, it's a completely random sample, and yes, I think it's always important to remember that the people who are actually responding are going to be possibly doing other things and maybe aren't even fully, on top of the fact that they may not understand how to answer the questions, may not be 100%, they might be cooking tea or doing whatever, but they do offer options for, like, would you be interested in doing this? We'll call you back at a time that suits you. Let us know what time suits you best. People with landlines get a letter letting them know that they'll be called, and I think that they call back. They're prepared to call back a number of times with people just to try and make sure that the time suits as much as they can. But you obviously can't, if someone doesn't want to do the survey, they won't.
Yeah, no, that's great. I wasn't aware of all these flexible options. And then the other question was, and I guess the answer is rather no, if we have any reliable data around cultural diverse attitudes, and how will we ever capture the attitudes of the non-English speakers if there are not interpreters used, or if, Peter was just saying it's about these qualitative conversations, but what research place does they have these conversations and holds them and holds their data?
Can I just quickly say about with the NCAS in particular, we have translated versions of the survey and interpreters that do this in 10 different languages, and the findings of this there's a report specifically on non-English speaking background respondents, and that's on that website that's at the end of the presentation as well, if you want to have a look at it.
I will.
Did anyone else want to?
Yeah, any other questions or comments? Thanks, Kumla and Nadine, who are working in multicultural agencies too. So we might go back to you, Karina.
We seem to have a sound problem with Karina and Peter and Stephanie at the moment. Perhaps Peter or Karina, if you could just make a comment, we'll see if we've still got a sound problem. Okay, no, we have a sound problem. We seem to have lost sound. There is a question here from Chantel. Even though Chantel doesn't have a microphone, we can't unmute Chantel. She has noted, she just wanted to mention a suggestion for those conducting surveys with called clients. In instances where caseworkers are already having meetings with interpreters, for them to complete the surveys with the clients one-on-one. Violetta or Liz, would you like to comment on that?
I think we might have sound again.
Okay,
Got it.
great.
Thank you.
Okay.
Did you want to?
I had been muted, which means the entirety of the Sydney office was muted.
Gotcha.
Okay, so now that we're back, so we have would you mind just repeating the question?
The comment was made, Peter, from Chantel, that those suggestions for those conducting surveys with called clients, in instances where caseworkers are already having meetings with interpreters, for them to complete the surveys with the clients one-on-one.
I think that the only concern there is about the potential for, I guess, mixture between what is actually kind of research and what is actually case support. That clear delineations need to be made, and people need to be confident that they can withdraw from research or not participate in that, and that wouldn't affect their ability to actually receive services. I think potentially if you're in a one-on-one situation with someone who has generally provided services to you, you might feel that you have to continue in the participation in the research, and that would be potentially problematic.
She did go on to say here, and sorry, Peter, there's one other comment from Chantel below. So she says, this way, if the interpreter is already present, the survey can just be conducted at the end of a casework meeting, and an interpreter doesn't need to be booked specifically to conduct a survey.
And I guess that's certainly, considerations around cost and those kind of things. Potentially training up that interpreter so that actually the caseworker isn't present might be appropriate. But again, I think the ensuring of that separation between service provision and research is important. So trying to do that creatively and in a way that does ensure that the interpreter is actually available is completely valid.
So Peter's main point being that the participant shouldn't feel under pressure to have to participate in the research, and that needs to be well explained in advance. Yeah.
Yeah, and then there's another comment just come through from Kumla as well, that sometimes the community is very small and the participant and interpreter know each other, and for that, having a meaningful discussion on a sensitive issue may be a challenge as well.
There's some interesting findings in the Aspire report. So research done by Kathy Vaughan as part of our core grant, which did really highlight some of the limitations around interpreters within communities and actually highlighted some of the highly problematic beliefs that some interpreters are reported to have. So interpreters can be quite a contentious or difficult thing for people to negotiate with people who've experienced violence. But Kathy Vaughan's work is quite excellent and very useful, I think, in some of the recommendations that it made in that area.
Yeah. Yeah, great.
And that's available on our website. Yeah.
Yeah.
Yeah, absolutely.
Yeah, and Nadine's just made a similar point on that as well, that some case managers might not feel comfortable speaking about family violence with called community members if the worker hasn't received training. So that's a really important aspect as well, to make sure that that training is provided and that there's the support to have those sensitive conversations.
Good. Did we have some other questions as well?
Yeah, so as we mentioned earlier in the webinar, we have in the Action Research Support team been quite mindful of the questions that you've asked us over the last 12 months or so around measurement, and we've done a bit of work to pull those together. So I might just pass back to Steph to pull out a couple of those questions that we have been engaging around.
Sure. Thanks, Karina. Yeah, another question that we have seen come up previously with projects is just around how you account for general human error when you are collecting survey data, and that you might be seeing results in your surveys that are inconsistent, or you're not sure if people have understood the meaning of the question, or they may have left blanks where they haven't filled out information, and how much you allow for human error and what you can do really to make sense of survey data if you are seeing patterns like that. So Peter, maybe I'll just throw it over to you first.
Sure. I guess the first thing to do is to make sure that you're as transparent about those limitations as possible. So if you are able to identify a tendency for people who have not responded to a particular question, or to have found a particular group or a demographic who might be less likely to be engaging with a particular question, then actually noting that is really valuable. Noting when you have non-answers is just as important as having answers. So if you have 20 people engaged in your survey, and for most of the questions everybody answers the question in front of them, but for a couple of those you say have only 15 people who are actually engaged, then actually noting that you had 5 non-responses is actually really valuable. It would also then mean that you would change what your percentages were, and you would make it clear whether your percentages were just including those people who did answer, or whether they were percentages out of the whole. So whether it was going to be 5 people out of 15 or 5 people out of 20, because obviously those are going to be really different numbers. It is also one of those things that I guess Violetta talked a little bit about, the processes of COG testing or running through and seeing what kinds of questions people do or don't answer. That might be indicating particular things to you. They might be indicating sensitivities within the community that you're working with. It might indicate that the particular questions are difficult to understand. So I think having that kind of iterative action research kind of engagement with your research tool is also really valuable. But bias is a thing that is going to be in all research, and it's not an indication necessarily of weak research that there is bias, but what it does require is people to think critically about that. So to think about the bias in what you ask, the bias in who it is that you're able to access, who it is that you haven't been able to talk to, what it is that those people think you've said, so what it is that they hear, and what it is that they feel that they can answer to you. All those things change what it is that you might get as your outcomes. And actually by thinking thoroughly and critically about what those possibilities could be, then you're able to actually inform your findings and make those much more rich.
Did you have anything to add?
I would just add that I think also kind of coming clean about those, and when you're reporting it, saying exactly what those are and pointing them out and saying, well, you know, this is what we found, but you must take into account X, Y, and Z. And I think if you're open and honest about those things, that's important.
And as you... Sorry, Peter, and as you said, in action research, it really is a requirement that we are transparent about the type of methods we're using and why we're using them. I mean, I think that's an expectation in most research, but it really is about also trying to be as upfront as possible and document the values that you're coming from and why you're asking questions of which groups and why.
Thanks, Liz. Yeah, and we've got a comment coming through from Nadine, and she said that she had to stop actual questionnaires with the COLD community she was working with, as they can't read or possibly can't read or write in English, and often and mostly mark the most positive answers, trying to please the facilitator. So yeah, so that's an interesting reflection on where it's,
and that kind of social bias is certainly something that I think Violetta, you would be able to speak to this much more in relation to the NCAS, but it is something that we're increasingly seeing as a challenge, that people become aware of what kind of answers are desirable, what kind of responses are seen as appropriate, and that then means that actually when someone asks you, well, what do you think about this, You go, oh, well, that's the answer I should be having. And so being able to actually access information about what people's beliefs actually are can actually be more difficult as you get a certain level of awareness within the community. So that's certainly not something that's limited to CALD communities.
Yeah.
Can I put another plug in here for Action Research and say Nadine and other projects actually documenting those experiences really add to the information base, the evidence base, the learnings that we have about how to really keep improving and engaging in the work that we do with communities. It's learning about what doesn't work and what are the difficulties as well as what is successful and what does work that matters.
Right, yeah, and Nadine just made the comment that they are aiming to document those experiences, which is excellent. So did we want to go to another question at this point? Yeah. We've got some other prepared question as well, things that have come up. But if anyone has anything else they'd like to discuss, please just pop it into the chat, or if you'd like to be unmuted, let us know by using the hand symbol as well. But another question that had come up was around, are there specific things that should be considered when you ask direct questions about experiences of violence? And this was in relation to asking about experiences of being a victim of violence and also a perpetrator of violence. And Peter, I'll just throw it to you first about what comments you have about that.
Certainly. So perpetrator surveys are quite contentious. In Australia, we have a really significant victimisation survey, so the personal safety survey that I've done some additional work with, but we have no perpetrator survey because they are considered to have significant methodological limitations. So the main challenge there is that basically you're going to people and saying, have you done this thing that we think is probably not so awesome? And that actually then means that there's significant concerns about the honesty of those responses. There is emerging, I guess, methodology, so ways of structuring those kind of questions, so to focus more on conflict and to structure the questions around that, but then there can also then be concerns around that normalising violence as well. So in order to get the honest responses, you need to kind of frame it in particular ways, so that precise framing may be problematic in itself. So asking about perpetration is difficult, and it's also very difficult then to determine what to do if someone does disclose. So particularly with people who, in aspects of their roles, are mandated responders or reporters, sorry, then that can become quite complicated. Similarly with victimisation, so considering what it is that actually the policies are within a particular service where a survey might be occurring, and what is appropriate there. So there's certainly a range of standardised questioning that people can use for asking about victimisation, and there are examples of that for different communities, but it's around determining, I guess, whether that information is central to the work that you're doing, because it is potentially distressing for people to disclose that to you, and particularly for a service, there would be potentially an expectation that there would be action taken on whether there was capacity for that within the service. That would be great. Yeah.
Thanks, Peter. Any comments from Violetta or Liz on that question?
I guess my only comment would be around, so for the NCAS, we don't ask anyone about their experiences, but there's a high chance, or there's a possibility, a likelihood that somebody might disclose or feel distressed by some of the questions. So making sure that people know that they can stop at any time, having resources, a list of resources. There's telephone numbers that can be given. People can withdraw their responses as well. So we give people different avenues depending on what happens during the telephone call, as well as briefing all of the interviewers really well about what might happen, what they need to do, how to respond if anything happens. So,
yeah. And the only comment I would add to that is that, as far as I'm aware, there's only maybe 2 of the Building Safe Community projects that might kind of fall into this area where they're really looking at people's use of services more than actually talking about the experience of violence. But similarly, as Violetta just outlined, you know, we've been talking with those projects about ensuring all those supports and considerations are made.
Fantastic. Thank you. So we haven't had any other questions come through. If anyone has any final questions that they'd like to raise, now would be a good time. Otherwise, I might hand over to Karina to
Yeah, so I just wanted to ask of you, Peter and Violetta, you know, with smaller projects that the Building Safe Community for Women projects are in comparison to the PSS or NCAS. And in the use of surveys, I think projects are collecting quite a broad range of information, and oftentimes or sometimes that might be tempting to do in the one survey. So things right from, say, attitudes or around violence or gender equality through to feedback around specific project activities or training sessions, that kind of thing. And I guess something that comes up is, you know, it would be really useful to have an idea of whether in these smaller projects, whether you should be quite targeted in what you're including in a survey, whether you should separate out some of those content areas, or whether you should try and get as much information as you can while you've got the opportunity. And yeah, I was wondering what you, Peter and Violetta, would think about those sorts of things.
I'll let you go first, Peter.
Oh, okay. So I guess it's always going to be a balancing act. Getting people to start a survey is an achievement, and so you may want to try to get a range of things within that. I would always say that there's a cost to doing research, that it's going to take people's time, it may be distressing to them, and it will also build up expectations within the community that something can be done with this material. And so it's ensuring that actually what you're asking is necessary, that you need to know this information. The big caution, I guess, I would have for this kind of omnibus approach is that, just me, that's exciting, is that it does mean that you may end up with things you're like, oh, this might be interesting in the future. And while that might be the case, I think it's fairly rare that it is, that most people find that those questions, that they're not really clear about exactly why it is that they're asking it, what it's going to do to be able to support them. They end up kind of taking up time and potentially causing distress and not actually contributing significantly. The other thing I think is that people's concentration does wane pretty quickly. Violetta mentioned the kind of maximum 20 minutes. That 20 minutes, regardless of, I guess, language limitations. So it's not, if you're a really fast reader, you could do 20 minutes, but if you're someone who actually is going to need some more support in understanding the material, then that might actually mean that the survey needs to be significantly shorter. But I think the 20-minute rule is quite a good baseline. Anything more than that, and you're really starting to tax people, and it does significantly reduce the quality of the data. Violetta, do you have an addition?
I agree with Peter, and I think it's about figuring out, probably the length of the thing you want to do, and then prioritizing what should go in that, because it's probably as long. It could, like the whole how long is a piece of string thing. Yeah. So. prioritizing what goes in, I think, is the most important thing. Make sure you get the most out of what you've got.
Thank you. And I think we have one more question.
Yeah, there's one more question that's come through from Nadine, and it's really just around what are there particular expectations around funding sources around what or how much evaluation we conduct. So, Nadine, I don't know if you wanted to expand on that at all. If we unmute you, I'm assuming you mean through from DSS, what are the expectations, which might be something to discuss in more detail, but yeah, we could perhaps unmute you to discuss that.
Yeah.
Yeah. I just wonder if it's something that is for DSS to discuss, but by all means, Nadine.
Okay. Well, I wasn't sure how much information you were given about this or not, but we never had any particular guidelines around this, and so I've never felt pressured in any way to do a particular amount of evaluation. But I just thought you would have some thoughts to this or had some guidelines to this. But if you don't, then that's fine. Like, yeah.
I'm sorry, is that a question to me, Liz, or?
Really, just if anyone has a comment to it. Like, as I said, my experience is that I haven't felt pressured to do a particular evaluation. I mean, many other funding sources sometimes have these guidelines to it, that you have to do particular surveys and things like this. Obviously, we didn't have this in this funding. But I'm just wondering, would there be an issue of not having done enough evaluation, for example, or, you know, do you have any comments to this? And if not, that's fine. Then we take this up in another way.
Yeah, no, I think it's something to take up in another way, and it is about really looking at this particular project has the flexibility of designing your own action research in relation to your specific work plan. So it's not like we can give an overall, you know, everyone has to do this.
Yeah.
So let's discuss it outside of the webinar, if that's okay.
Okay. Yeah, sure.
And it might be...
And I believe a few people need to leave quite soon too, so just to let you know that, Karina.
Yeah, of course, yeah. Yeah, and I was just going to add to that, Liz, that, you know, some of the things that we talk about in action research about seeing the action research itself as an evaluation process that is ongoing, that's happening throughout the project, is something to consider as well outside of any funding requirements, I would say.
Yeah.
So, yeah, we will just wrap up now, I think. So, Tina, if you wouldn't mind moving on to the next slide. So, we've put together a bit of a list of resources and that are up here, but we will remind you that there are quite a few great resources on the ANRO's website's Action Research Support page. And as always, the Action Research Support team is here, and also our in-house expertise, which is experienced today with Peter and Violetta, are available as well to support you in your work. And I just wanted to reiterate the key messages that Liz had introduced at the beginning of this webinar. We've had quite a lot of excellent content and detail around methodologies today, but just as takeaways, again, to remember, like, have a go, but report using caution, don't overreach, but do continue to reflect and use the action research, because it's a great quality improvement tool, even beyond the Life of the Building Safe Community for Women project grants. So just a short takeaway. And as we close now, there will be a very short survey that will pop up, and we'd really appreciate it if you filled that in for us. It's useful for our own evaluation of our own work. So thank you very much.
Thank you.
Thank you.
Thanks to our presenters.